2020 Employee Training, COVID-19 Worker Health and Safety. Training is effective September 4th, 2020. Module number 2, Measures and Precautions. Module 2, Measures and Precautions. This module outlines measures and precautions that can be taken to provide safer learning and work environments for students and staff during the COVID-19 pandemic. These include conducting regular screening, practicing appropriate hand hygiene and respiratory etiquette, using personal protective equipment or PPE and appropriate face coverings, and maintaining physical distance where possible. Coronavirus transmission. The coronavirus can be transmitted when people are in close contact with an infected individual. Coronavirus is most commonly spread from an infected person through respiratory droplets from coughing or sneezing, close, prolonged personal contact, such as touching or shaking hands, and touching something with the virus on it, then touching your mouth, nose, or eyes before washing your hands. Prevention. Preventable measures to manage COVID-19 transmission include self-monitoring and screening, physical distancing, hand hygiene, respiratory etiquette, and environmental cleaning. Respiratory etiquette. When coughing or sneezing, cough or sneeze into a tissue or the bend of your arm, not your hand. Dispose of any tissues you may have used as soon as possible in a lined wastebasket. Wash your hands afterwards. Avoid touching your eyes, nose, or mouth with unwashed hands. Protect yourself from coronavirus. Symptoms. Please note that it may take up to 14 days after exposure to COVID-19 for any symptoms to appear. However, individuals may also be asymptomatic. Symptoms of COVID-19 can vary from person to person and in different age groups. Common symptoms of COVID-19 include new or worsening cough, shortness of breath or difficulty breathing, temperature equal to or over 37.8 degrees Celsius, sore throat, difficulty swallowing, lost sense of taste or smell, gastrointestinal symptoms including abdominal pain, diarrhea, and vomiting, runny nose or nasal congestion. Symptoms continued. Atypical symptoms of COVID-19 include fatigue, malaise, and myalgias, delirium or acute altered mental status and inattention, unexplained or increased number of falls, acute functional decline, exacerbation of chronic conditions, chills, headaches, barking cough, making a whistling noise when breathing, and pink eye. Screening. All staff and students must self-screen every day before attending schools or boarding a school bus. School boards will provide parents with a checklist to perform daily screening of their children, and self-assessment tools will be made available to staff to ensure awareness of possible symptoms of COVID-19. If a student or staff member is experiencing any symptoms of COVID-19, they must use Ontario's self-assessment tool and follow the instructions. Screening continued. All staff and students who are experiencing new or worsening symptoms consistent with COVID-19 must not attend school or work and should seek appropriate medical attention as required, including getting tested at a COVID-19 testing center. Signs are posted at entrances and throughout the school board buildings to remind students, staff, parents, caregivers, and essential visitors of screening requirements. Self-monitoring and screening. Prior to arrival at any Upper Canada District School Board workplace, it is imperative that all persons prior to entering the UCDSB premises perform Ontario's self-assessment on the day they are entering. See the self-monitoring screening checklist signage for details, and that's on the next slide. Self-monitoring and screening checklist signage. The signage has been provided by both health units of our school board and states, "Stop COVID-19. Do you have any of the following? New or worsening cough, a fever, difficulty breathing, sore throat, trouble swallowing, loss of taste or smell, runny nose or red eyes, not feeling well or sore muscles, nausea, vomiting, or diarrhea. Have you been in close contact with someone who is sick or has confirmed COVID-19 in the past 14 days? Have you returned from travel outside of Canada in the past 14 days? If you answered yes to any of these questions, do not enter the school and self-isolate right away. Seek further assessment from a healthcare provider, a COVID-19 assessment center, or local health unit. For students, if you answered yes to any of these questions, go to the office to be assessed. Reporting procedures. Employees must report to their employer any circumstances in a workplace that is likely to be hazardous to the health or safety of employees or others in the workplace. This includes reporting their own potential exposure to COVID-19 that caused or is likely to cause illness to the employee or to any other person. If you have symptoms of COVID-19, you should inform your supervisor, go home if at work, and follow the advice of your healthcare provider and/or get tested at a local testing center. To avoid spreading the virus to colleagues and students, if you have symptoms of COVID-19, you have a duty to isolate as directed by public health. Hand hygiene. Appropriate hand hygiene is one of the most important protective strategies. Schools should be prepared to train students on appropriate hand hygiene, including the use of alcohol-based hand rubs, and to reinforce its use. Hand hygiene should involve scheduling breaks to allow students to wash their hands at appropriate times during the school day, above and beyond what is usually recommended, for example, before eating food, after using the washroom, and after coughing or sneezing. Students have shown that performing hand hygiene 5 or more times per day will reduce the transmission of viruses and gastrointestinal illnesses. Hand hygiene continued. Alcohol-based hand rub with a minimum of 60% alcohol concentration throughout the school, including ideally at the entry point of each classroom, and/or plain liquid soap in dispensers, sinks, and paper towels in dispensers. Soap and water are preferred as it is the most effective method and the least likely to cause harm if accidentally ingested. Alcohol-based hand rub can be used by children. Soap and water should be used if hands are not visibly soiled. Paper hand towels are preferred to hand dryers. Hand hygiene. Perform hand hygiene upon entry and exit of buildings. At UCDSB workplaces, hand sanitizer will be provided at the main and select areas where hand washing facilities are not available. Perform hand hygiene during the day, before, during, and after preparing food, before eating food, before and after handling shared equipment and objects, before and after caring for someone who is sick, before and after treating a cut or wound, providing first aid, before and after putting on gloves or other PPE, after using the toilet, after blowing your nose, coughing or sneezing, and after touching garbage or waste. Wearing gloves is not an alternative to hand washing. How to wash your hands. Stop the spread of germs. Wash your hands for 20 seconds using the following steps. Number 1, wet hands. Number 2, apply soap. Number 3, rub hands, palms to palm. Number 4, lather the backs of your hands. Number 5, scrub between your fingers. Number 6, rub the back of your fingers on the opposite palm. Number 7, scrub nails. Number 8, wash fingernails and fingertips. Number 9, rinse hands. Number 10, dry with a single-use towel. Number 11, use the towel to turn off the faucet and open the door. Number 12, dispose of towel in the garbage. Clean your hands with hand sanitizer for 20 seconds. Apply enough sanitizer to your palms. Rub hands together. Rub back of each hand. Rub fingertips of each hand in the opposite palm. Rub together and around fingers. Rub each thumb. Rub each wrist. Safe handling of alcohol-based hand sanitizer. Store sanitizer out of the reach of students when not in use. Always supervise students when they are using hand sanitizers. Try to limit hand sanitizer product accumulation on carpets, floors, and surfaces. Hand sanitizer can create a slippery floor condition. Clean up any hand sanitizer spills. Hand sanitizer is flammable, so store away from sources of fire. Store hand sanitizer in a cool, dry location. Note: Ontario Office of the Fire Marshal states that hand sanitizers products are dispensed in small quantities, thus the fire hazards they present are minimal. However, certain precautions are recommended to achieve an acceptable level of fire safety. Learn more from the safe practices of the use of alcohol-based hand rubs. Masks and personal protective equipment. Kindergartens to grade 3. Students will be encouraged to wear masks in indoor spaces and on school buses. Non-medical masks will be made available to students. Grades 4 to 12 students will be required to wear their own non-medical or cloth masks indoors in schools and on school buses. Non-medical masks will be made available to students. Reasonable exceptions on mask requirements will apply, and examples of that would be medical conditions and disabilities. On outdoor times like recesses can serve as a break for students from wearing masks within their cohorts. Medical masks and eye protection or face shields will be provided to all staff of school boards. All school-based staff will be required to wear masks without reasonable exception for medical conditions and disabilities as identified by staff to their supervisor and employer. Medical masks for school-based staff. Medical masks, or PPE, are provided as a precaution for the protection of employees when the work is required, and the risk related to COVID-19 cannot be sufficiently mitigated through physical distancing and proper hand hygiene. As per the ministry, medical masks and eye protection or face masks will be provided to all staff of school boards. All school-based staff will be required to wear masks with the reasonable exceptions for medical conditions and disabilities as identified by staff to their supervisor and employer. The board has provided medical mask to be worn by all school-based staff. What's the difference between a non-medical, e.g. Cloth mask, and a medical mask? So non-medical masks and medical masks do not offer the same protection. Non-medical masks are used for source control, meaning they protect the people around the person wearing with the mask and not the persons themselves. They act to keep an individual's own respiratory droplets contained within the cloth mask. Medical masks are personal protective equipment. They minimize exposure to hazards and prevent illnesses and infection for the wearer. Medical masks and precautions. Replace mask every 4 hours. Replace mask if it becomes contaminated. Replace mask if it becomes wet. These masks are not reusable, single use only. Store in a dry, ventilated place and keep away from flames and flammable materials. Stop using in case of discomfort. If a symptomatic individual tests positive for COVID-19, they should continue to remain in isolation at home and follow the directions of their local public health unit. Personal belongings brought to the school should be minimized. Water bottles will be filled rather than drinking directly from a mouthpiece of a water fountain. Schools are asked to significantly limit visitors. Environmental cleaning. Surfaces that are commonly touched, such as doorknobs, handles, keypads, etc., will be disinfected as per the board's cleaning protocol. When you are at UCDSB workplace and are using a shared equipment, such as photocopiers, keyboard, or telephone, you must wash or sanitize your hands before and after using the equipment. Avoid sharing equipment if possible. Prior to using a disinfectant or cleaning product, please review the safety data sheet. These are available through the staff web portal under Health and Safety and WMIS. And the manufacturer's recommended guidelines on the label should be read. What cleaning procedures should a school or workplace take when an individual is suspected of having COVID-19? So schools or workplaces will establish protocols for identification and communication of suspected or confirmed cases to administration and relevant staff to determine contaminated areas and carry out cleaning and disinfection, including timing, return to use, methods, PPE, and waste disposal. Identify areas that may require cleaning plus disinfection, items used by the individual in all spaces within 2 meters of that ill person versus cleaning alone, such as a hallway or a room where the individual has passed through. Use disposable cleaning equipment where possible. Remove all items that cannot be cleaned, books and paper, etc., and store them in a sealed container for a minimum of 7 days. What will this look like in the school or the workplace? PPE, personal protective equipment, medical grade masks, and eye protection face shields will be provided to all teachers, supervisors, and other staff of school boards. Signage. Directional signage will support distancing and one-way use of hallways, adjustments to entrances and exit practices, adjustments to the use of playgrounds and school grounds, signage in bathrooms and common areas to indicate maximum capacity and availability of hand sanitizers. It is important to not reduce the number of exits and to ensure that the fire code is adhered to. The safe monitoring of screening checklists with symptoms will also be posted at school entrances as a reminder. Personal items. Personal items being brought to a school, such as a backpack, clothing, sun protection, water bottles, and food, should be labeled and stored separately in cubbies, designated areas, or lockers. What will this look like in the schools? First off, physical distancing. As much distancing as possible between students and staff, between staff members should always be promoted. Physical distancing measures are to be supplemented with public health measures supported by public or health and safety strategies, such as screening, adapted school environments, cohorting, hand hygiene, enhanced cleaning, and masking. Remove unnecessary furniture and place desks with as much physical distancing as possible. Teachers should make as much teaching space as possible. Desks should face forward rather than in a circle or grouping. Schools are encouraged to locate larger classes in larger spaces and to use all available spaces in a school, including gyms and libraries. Congregation of teachers and staff should be limited to minimize potential of adult-to-adult transmission. Physical distancing. Physical distancing or social distancing is the act of avoiding close physical contact with others. Physical distancing helps to limit your exposure to respiratory droplets of a person infected with the virus. At the Upper Canada School Board workplace, the expectation is that people will remain 2 meters apart when possible. This is as recommended by the Public Health Ontario. Educators who are in close contact, less than 2 meters, with students, staff, and other personnel were provided with expected to wear appropriate personal protective equipment, or PPE. Educators will be required to wear medical masks and, if necessary, eye protection, which could be a face mask or goggles. Personal protective equipment. PPE is protective clothing or equipment designed to protect the wearer's body from COVID-19 virus infection. Medical masks and eye protection or face masks will be provided to all staff of school boards. All school-based staff will be required to wear masks. Other PPE provided are gloves, medical masks, face masks, and gowns. PPE should be worn where it is necessary as a reasonable precaution for the protection of a worker. When the worker presents a risk related to COVID-19, cannot be sufficiently mitigated through physical distancing and proper hand hygiene. PPE requirements may be identified in protocols or communicated through their supervisor. Disposable PPE must be discarded immediately after use, and reusable PPE can be cleaned and disinfected immediately after removal. So general PPE recommendations. Potential exposure, there's 2 listings, potential exposure and COVID-19 PPE needs. And these needs are in addition to any standard PPE normally issued for chemical usage, etc. So exposure, able to maintain physical distancing practices. The need is medical mask. Face shields and safety goggles should be available in case a need arises. Next, exposure is not able to maintain physical distancing. Supporting a student is the example. The need is medical mask, face shield, and or goggles. The potential exposure is potential exposure to body fluids such as saliva. So somebody in a behavioral situation, assisting with toileting, personal care, unable to maintain physical distancing practices. The need would then be medical masks, face shields and or goggles, disposable gown, protective or disposable gloves. The exposure, potential exposure to body fluids during first aid, unable to maintain physical distancing practices. The PPE need is medical mask, face shield and or goggles, disposable gowns, and disposable gloves. The last exposure is care of suspected or confirmed COVID person and unable to maintain physical distancing practices. The PPE need is medical masks, face shields and or goggles, disposable gowns, and disposable gloves. Reminder, physical distancing, as much distancing as possible between students and staff and between staff members should always be promoted. Personal protective equipment, sequence to donning and putting on PPE. Perform hand hygiene first, number 1. Number 2, putting on a mask. Place mask over nose and under chin. Secure ties, loops, or straps. Number 3, protective eyewear or eye protection. Put on the eye protection, adjust to fit. Face shield where required, should fit over brow. And number 4, put on gloves, taking care not to tear. The breakdown of the PPE, donning isolation gown. Step number 1, put on an isolation gown, tie all the ties on the gown. Step number 2, donning or putting on medical mask, part 1. Clean hands with soap and water and or using hand sanitizer. To put on the mask, open the package and take out mask. Place mask to the face with the nose piece clip on the top part of the mask. Secure straps or loops over the ears and adjust it until feeling comfortable. Then you want to position mask on face by pulling the lower edge under the chin and the upper edge over the nose. Avoid touching the front of the mask with your hands. And then part 2, the final step, use both hands moving from the middle of the nose clip to both sides. Press the nose clip to ensure positive face seal. Step number 3, donning eye or face protection. There's 2 types of eye or face protection. The face shield provides full face coverage and protection, and goggles also provides protection for eyes, but fogging is sometimes an issue. Wearing eye or face protection in addition to medical masks can ensure the eyes are protected if there is potential exposure to respiratory secretions. Protective face shields and goggles. Face shields provide direct splash protection. Anti-fog and anti-static treatments are available. They're latex free, fiberglass distortion free, foam head relieves pressure, lightweight optical clear, material is PET, and the weight about 40 grams. How to care for the face shield. Submerge your face shield in warm water and use a soft cloth or sponge to gently clean it. Adding a mild soap water help with the cleaning process. After you're done cleaning the face shield, rinse off with rinse off any soap residue. Use a cotton towel or microfiber cloth to dry your face shield. You can use 70% alcohol wipes to clean and disinfect your face shields, and shields can be used until damaged. Check regularly to ensure there's no cracks or scratches or sharp edges, etc. before wearing, and discard immediately if there's any damage found on the shield. So cleaning a soiled face shield or goggles for reuse. Again, the process is wash your hands, don a pair of gloves, wash face shield or goggles with soap and water if visibly soiled. After you're done cleaning the face shield or goggles, rinse off any soap residue and leave it to dry in a secure area. Or use a cotton towel or microfiber cloth to dry. You may wish to use alcohol wipes or sanitizing wipes to clean and disinfect your shield or goggles if needed. Shield and goggles can be used until damaged. Check regularly for scratch or cracks or sharp edges, etc. before wearing, and discard immediately if any damage is found. Store in a clean, dry, and secure area. Donning or putting on disposable gloves. First you want to do is you want to clean your hands with soap and water or hand sanitizer. Then you want to take out the glove from an original box. Touch only the restricted surface of the glove corresponding to the wrist at the top edge of the cuff. Don the glove. Take the second glove with the bare hand and touch only the restricted surface of glove corresponding to the wrist. Turn the external surface of the glove to be donned on the folded fingers of the glove hand, and thus permitting the glove onto the second hand. Once gloved, hands should not touch anything else that is not defined by the indications and conditions of the glove use. Personal protective equipment, sequence to remove PPE. When placing PPE in waste bags, ensure to tie off the bag and request that it be removed to waste collection bins. So removing gloves is the first step. Remove gloves using a glove-to-glove, skin-to-skin technique. Grasp outside of the edge near the wrist and peel away, rolling the glove inside out. Reach under the second glove and peel away. Discard immediately into a waste receptacle. Number 2, perform hand hygiene. Number 3, remove eye protection. Arms of goggles and headband face shields are considered clean and may be touched with your hands. The front of the goggles or face shield is considered to be contaminated. Remove eye protection by handling earlobes, sides, or back only. Discard into waste receptacle or in an appropriate container to be sent for reprocessing. Removing a mask. The ties, earlobes, and straps are considered clean and may be touched with hands. The front of the mask is considered to be contaminated. Untie bottom tie and then top tie or grass straps or ear loops. Pull forward off the head, bending forward to allow mask to fall away from the face. Discard immediately into waste receptacle. Perform hand hygiene. Step 1 and 2, removing disposable gloves and gowns. Disposing of gloves immediately in the garbage container when you're done. Remove gowns and dispose immediately in the garbage container when completed, then wash your hands. Step number 1 for the gloves, pinch and hold the outside of the glove near the wrist area. Number 2, peel down away from the wrist, turning the glove inside out. Number 3, pull the glove away until it is removed from the hand, holding the inside out glove with the gloved hand. Number 4, with your ungloved hand, slide your fingers under the wrist of the remaining glove. Do not touch the outer surface of the glove. Number 5, peel downwards away from the wrist, turning the glove inside out. And number 6, continue to pull the glove down and from the inside out, glove being held in the gloved hand. Step number 3, removing eye protection and face protection. Carefully remove face shields or goggles by grabbing the strap and moving and pulling upwards and away from the head. Do not touch the front of the face shield or goggles. Face shield wearers should wash their hands before and after removing the face shield and avoid touching their eyes, nose, and mouth when removing it. If the face shield becomes damaged, don't try to fix it and dispose of it in a waste bin and get a new one. Step number 4, removing medical masks. If wearing gloves, remove gloves first. Wash hands with soap and water or hand sanitizer. To remove the mask, avoid touching the front of the mask. It is considered contaminated. Grab the ear loops of the mask. Pull mask forward and off your head. Discard mask in waste bin. Clean hands with soap and water or hand sanitizer. How will supporting student learning change? How will you recognize the different experiences of students and consider mental health and well-being as part of our planning? What are some things you have been thinking about in terms of changes to the way you teach? Given the precautions and measures that you've learned about in this training, what will you need to rethink? The examples are classroom arrangements for physical distancing, class time for hand washing, signs posted in the classroom. How do you plan to make learning engaging within the new environment? This is the end of module number 2.